do want to come back to the indoor cannabis lounge and Toronto challenges, smoking laws, clinical research standards. This is lit, Club Lit, obviously. What's going on?
Yeah, it's an issue. Obviously, they've been around a couple years now, really pushing the limits of what can be done with that Health Canada testing license, the organoleptic testing license, which means allowable for human testing. There are other licenses like that around the country. Several people pointed out there is another similar to what Lit is doing in Ontario, I believe, at the old CanTrust facility.
Yeah,
And
Joint Craft. Yeah.
Joint Craft, thank you. Yes.
Craft, yeah.
Shout out to Joint Craft. There's several people who pointed out we should have given them some flowers there as well. And obviously, a lot of companies, Rubicon here in BC, and I know there are plenty of other companies that have their own organoleptic license where they can do testing on site as well. I don't think Health Canada's interpretation of things is necessarily aligned with what Lit is doing, and so I imagine we'll have to keep an eye on that. I don't know it's a huge priority for the regulator, but I'm not sure it's entirely within the spirit of their intention with that.
Yeah.
Setting that aside, I think, what they're doing and other locations like that, it's quite interesting in terms of being able to push the boundaries of that indoor consumption. I was just having a conversation with a producer about this last week here in BC who would really like to see something in BC. One of the challenges here in BC is we have provincial smoking laws that can't be superseded by municipalities.
Right.
My understanding is in Toronto, they were able to create kind of a bylaw allowance. They had to put in extensive filtration and exhaust system to make it compliant with municipal rules. But Ontario didn't have anything in place that would prevent it. BC does, and so that's a big sticking point when the British Columbia government has been talking about consumption spaces. They've always emphasized vaping and smoking indoors is never going to be a possibility. Now there are, there's a little bit of gray area there in terms of what an indoor and outdoor space is, but essentially you can't have more than one wall. You can have a roof and one wall, and then you need 3 open walls to be able to do that indoor consumption. But yeah,
absurdity
I think
just drives me insane sometimes, man. It's like, like, come
well,
on.
it's interesting. It's interesting because these are all rules that were put in place for tobacco, right? And